Let's bring him in from Akron Children's Hospital, our good friend, Dr. Joe Congini with us. And Joe, high heat, man. It's good to get out and exercise and enjoy the activities, but you got to be a little smart, too.
No doubt about it, Ray. I mean, heat is coming in the picture, and things are a little bit different with the new normal. So I did want to talk about a couple things. How are things going with this phased-in conditioning program for high school athletes? We would be week 5 right now. In the most advanced of cases, we could be in phase 3, and the first couple phases have gone well. But what we've seen, Ray, in 30-plus schools or so that we're involved with and others that we know and work with, is that many people started a little bit late. They're moving along it a little bit more slowly. But as of right now, so far from the schools that we've worked with, we have not come across, thankfully, a single case of somebody who has had to be sent home because of symptoms, who's gotten worked up, who has a positive test. We haven't had one in the schools that we work with, so we're very happy about that. But in the meantime, I will tell you, Ray, that it is very complex on the other side. So that, for instance, we have several situations that come up several times a week where a sister or a dad or somebody else was positive. How does that affect the athlete, who then affects the rest of the team? So there's a lot of very difficult questions. And so this new normal, this new job that our trainers are taking care of in the schools now is very, very complex to try to sort through this. We were calling it last week, I think, infection control specialist. And this job is not easy. So there's some complexities out there. But as of this week, we've not had in our schools or any really that we've heard of any kids athletes that have been positive that they've told us about. Now, at a lot of schools, it's much less than 100% participation. Since this is a time of year that people certainly don't have to be for high school out practicing, many schools have maybe 50% of their athletes. Again, this isn't just football, soccer and other sports. They may be at 50%, 70%. Some schools are up around 90% participation. So there's a lot of kids out there. So far, so good. Our trainers are doing a wonderful job monitoring it. So that's number one. Number two, you brought up the issue of heat. And so you and I always talk heat as it gets to the heat season. And here we are in June and July, and these are pretty high heat seasons. And a couple unique things again this year from the new normal. And the unique thing is usually we're talking right now saying, hey, this would be a perfect time for acclimatization, get the kids out there right now, get used to the heat now so that when August starts and they're really in full practice mode, that they're going to be used to the heat. But in reality, over the last 15, 20, 25 years, we've talked about this, that doesn't always happen very much. This year, because kids are practicing, it is happening. So we have a lot of kids that are acclimatizing to heat, and that's good news. And 3 good things that have come up. Number one, it seems like forever ago, but 4 months ago we had the world's expert on heat illness here in town and spoke to all of our trainers and all of our docs in the region at Firestone Country Club. It was like the last conference that took place at Children's before they had to hold off on conferences because of COVID. So we have a lot of instruction, number one. Number two, typically in June and early July, trainers are not around to monitor kids from heat. And so number two, with the athletic trainers, certified athletic trainers being around, it's going to be that they're a lot more present to help with this heat illness problems that we're talking about. And so the fact that they're getting a chance to get out there in advance of things, kids, and really acclimatize and really get used to the heat, it's really happening this year. So this is probably another one of those kind of positives of the new normal, is kids are getting used to this. And I think if we continue on through phase 3 and into a possible phase 4 coming up, I think kids are going to be a lot readier for the heat this year than they have been in previous years.
Yeah, and even though they're younger, Joe, I would throw that out for the next week, is that even though they're younger and some of the kids think they're indestructible, if they are running and training and that type of thing, morning and evening, right?
No doubt. and all the teaching out there about making sure that we're doing a good job with hydration, making sure that we're taking breaks, making sure that we're getting in the shade. And again, a lot of that is that interaction between the athletic trainer with the coaching staff and having a plan. And so far, again, what I'm getting from all the schools in the region, the coaching staffs are really bending over backwards. They're really doing their homework, getting ready, not only with the infection control, but also this week with the heat. So I'm pretty happy with the good job. And again, I want to give a tip of the cap to the sports medicine team. With them being out there, we feel a lot more comfortable that young kids are safer, and that's the ultimate goal of all this, isn't it, Ray?
It sure is. Joe, thank you for the visit. Stay safe, stay well, and we'll catch up with you next week after the holiday weekend.
Sounds good, Ray. Have a great holiday.
You too, my friend. Dr. Joe Congini, he joins us here on the Ray Horner Morning Show for over 20 years.